To ensure optimal comfort and recovery after your surgery, please follow the simple post-operative instructions. Discomfort, bleeding, swelling, and bruising are normal and may be expected after the extraction of wisdom teeth. Antibiotics may be prescribed to reduce the risk of infection. Take 1 capsule of clindamycin 300 mg every 6 hours or 4 times a day for 7 days. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, start taking 1 tablet of naproxen sodium, or also known as Flanax Forte 550 mg every 4 to 6 hours, only as needed. If your pain is not controlled by NSAID alone, contact us so we can prescribe a stronger pain reliever. Notify us if you are allergic to penicillin or NSAID, or you have gastric disorders. Be certain to take your medications with food, because this will help prevent gastric pain. Some oozing or bleeding is normal. Bite firmly on the sterile gauze pad given to you for 30 minutes. Avoid using cotton or tissue as it is not sterile and may only obstruct the site. Replace the gauze pads over the area for 30 minutes only if there is still active bleeding. Avoid constant replacement, as this will cause removal of clot formation and prolongs the bleeding. The amount of bleeding will vary from person to person. Most of your bleeding will slow within 3 to 4 hours, but a small amount of bleeding is common for 1 day or more. Swelling is a major cause of post-extraction discomfort. Swelling may start as early as tonight, or typically peaks by the 3rd day and start to resolve. It can be reduced by the use of an ice pack. Things to avoid: do not smoke for at least a week. Smoking will increase your bleeding, and nicotine, tar, and tobacco impairs healing and cause a painful complication known as dry socket. Avoid using straw when drinking. Avoid vigorous spitting and forceful rinsing. It may prolong your bleeding and add to your pain. No lifting or strenuous physical activities for the 3 days after the surgery. Physical activity increases your blood pressure, which can cause an increase in your swelling, pain, and bleeding. You may gradually return to your normal activities after 5 to 7 days. Do not apply pressure with your tongue or your fingers to the grafted area. Do not lift or pull the lip because it can tear and damage the surgical site. Rest with elevated head using 2 to 3 pillows to help with the swelling for 3 days. As for your diet, you may eat right away after your surgery. You may start with clear liquids and gradually ramp up your diet as tolerated. A soft, plain, and cool diet are recommended. Avoid nuts or any small hard bits that can get entrapped in the site. Always cool down any hot food or liquids during the first 24 hours. Some other examples of food you can eat are soups, eggs, and mashed potatoes. Do not use a straw for the first week after the surgery to prevent dry socket. For the first 24 hours, a cold compress will help relieve discomfort and minimize swelling. Apply the ice pack to the side of your face within 30 minutes and transfer it to the opposite side if needed. Continue icing the face for the first 24 hours. Do not freeze the skin. Ice packs are useful for the first 24 hours only. For your oral hygiene, an antiseptic mouthwash is recommended. You can gently soak the site with Orahex Forte with zinc, 10 ml concentrated for 1 minute, twice daily, after meals and most especially after brushing at bedtime for 14 days or until with open wound. Do not eat or drink for 30 minutes. Avoid over-the-counter mouthwash. For your brushing, soft bristle toothbrush should be used for 7 to 14 days. Brush your other teeth very slowly and carefully avoiding the surgical site. Brush in a small circular motions and away from site. Do not spit, just allow it to drain by tilting your head towards the sink. The day after surgery, you can now begin to brush all your teeth gently and carefully. It is important to brush even if the teeth and gums are sensitive, and most importantly on the back part of your second molars. Bacterial plaque and food accumulation near the extraction site will delay healing.
Tepe has a brush for everyone, even for those who have just had dental surgery. Once you are able to brush around the surgical site, Tepe has a super soft brush that allows for gentle cleaning while the area is healing.
The Tepe Special Care toothbrush has 12,000 ultra-soft bristles. This toothbrush is recommended for brushing after oral surgery and for patients with sore or very delicate oral tissue, very sensitive root surface, extremely dry mouth, and after radiotherapy. The neck of the brush can be angled in hot water for better access.
On the third day after surgery, begin saltwater rinses and continue this for 2 weeks. Rinse with warm salt water 4 to 5 times each day. To make the salt water solution, dissolve 1 teaspoon of salt in a small glass of warm tap water. If you have been given an irrigating syringe, start irrigation 3 days after surgery to wash away food debris in the surgical site. Fill the syringe with warm salt water or antiseptic mouthwash and place the tip of the syringe into the extraction site to clean. Do this 3 to 4 times a day for 2 weeks and listen as the surgical site heals. Schedule your next appointment for your follow-up and suture removal after 2 weeks.
The second phase of your surgery will be after 3 to 5 months.
If you have any additional questions, please contact our office and our staff will help you in any way we can to make your post-operative recovery successful. Thank you for choosing Tahonera Dental Center and hope to see you after 2 weeks.